Hello, Assalamu alaikum. My name is Dr. Ashik Hussain and I'm an assistant professor of anatomy at Rashid Latif Medical College, Lahore, Pakistan. In this video, we are going to learn about the anterior muscles of the anterior compartment of the thigh, and these muscles are sartorius muscle, then a group of muscles which are called muscles of quadriceps femoris. So in a while we will look at the muscles of quadriceps femoris. First of all, sartorius. So this muscle is called Sartorius. The word Sartorius came from the word. Its original meaning is to repaired or to be repaired or patched one, just like tailor. He patches or repairs something. So it is also called a tailor muscle. Look at this. This muscle originates from the anterior superior iliac spine. Anterior superior iliac spine here. This muscle, and this is a strap-like muscle which goes downward and obliquely across the upper part of the thigh and inserted onto the medial side of the tibia, medial side of the tibia in its upper part, along with two other muscles which are called semitendinosus muscle and gracilis muscle. So what I always used to teach my student mnemonic as a Sardar, Ganda, Singh from Toba take Singh. Sardar, Ganda, Singh from Toba take Singh. Sardar for Sartorius, Ganda for gracilis, and Toba take Singh semitendinosus. So this muscle is supplied by the femoral nerve, and look at this muscle is crossing the hip joint. This muscle is also crossing the knee joint. So it's this action of this muscle is on the two joints. So what this muscle does, the way tailor sits while across with the crossed legs, so same is the action produced by this tailor muscle. So what it does produces flexion on the hip joint. It does produces flexion. It produces abduction of the lower limb. It produces medial lateral rotation of the femur, and it produces medial rotation of the tibia when the femur knee joint is flexed. So this is the action of the muscle. Then we have got this muscle which is called then we have got other group of muscle which are called quadriceps femoris muscle. So this quadra means four and sep means headed. So this muscle has got four heads. So it is further, it has got different parts: vastus lateralis, rectus femoris, vastus lateralis, and vastus medialis, and below this vastus medialis we have got vastus intermedius. So this muscle is basically comprised of four further muscles or groups parts. So that's why this is called quadriceps, means muscle with four heads. So first of all, rectus femoris. Rectus word means straight and femoris means femur. So this is straight muscle. Look at this. My example is bipinnate muscle. Pinnate means feather, and look at the muscle fiber. They are arranged like fibers in a quill or a feather of a bird or hen. So this is called muscles of the bipinnate muscle. So look at this. It has got two origins. First of all, it originates from the anterior inferior iliac spine, which it is the straight head, and reflected head is from the roof of the acetabulum. So again, from the medial aspect, anterior inferior iliac spine and the roof of the acetabulum. So, and this muscle along with the other muscles of the quadriceps femoris attached onto the base of the patella. These all quadriceps muscles, they have got common insertion. So we will discuss in a while. So this was straight head. Now we will come for the Vastus lateralis. Look at the vastus lateralis. It attaches onto the greater tubercle, a greater trochanter of the femur, and then it is attached onto the lateral lip of the linea aspera behind. So it is attached onto the greater trochanter, and posteriorly linea aspera. So it's insertion is again on the base of the patella, and some of its fiber also insert onto the lateral side of the patella, and some directly on the tibia as a lateral retinacular ligament or retinacular fibers. Now this is vastus medialis. This vastus medialis, it originates from this is intertrochanteric line. So lower part of the intertrochanteric line, and then it attach itself onto the spiral line around the neck of the around the upper end of the tibia, then onto the medial lip of the linea aspera. Here you can see that, and further it attaches onto the supracondylar line, which is downward continuation of the medial supracondylar medial lip of the linea aspera. So this is vastus medialis. Look at its insertion. It's inserted into the base of the patella. This is base of the patella. This is apex downward, and here some fibers they attach to the lateral side of the body of the patella, and few of fibers of vastus lateralis directly attached onto the tibia as a lateral retinacular ligaments. So this is vastus intermedius. Look at the vastus intermedius. This is the muscle which is directly in contact with the femur, shaft of the femur. So it originates from the anterior and lateral surfaces of the shaft of the femur. So again this muscle is inserted into the base of the patella, So all these four muscles, they actually make a conjoined insertion, common insertion, base of the patella, medial and lateral border of the patella, and few of fibers they directly attach to the tibia as a retinacular ligament. This is the muscle of tendon of the quadriceps femoris, and then from patella they apex they a ligament which passes on and it attaches onto the tibial tuberosity. So as a result, these all quadriceps muscles, they are inserted into tibial tuberosity, and when these muscles will contract, what they're gonna produce? They're gonna produce the extension of the knee joint. They're gonna produce extension of the knee joint. So these all muscles, they are supplied by basically a femoral nerve, which is the nerve supply of the anterior compartment of the thigh. So again, Sartorius, rectus femoris, vastus medialis, vastus lateralis, and then vastus intermedius. Thank you very much.